Hello, and a really warm welcome to this session on evidence mapping at the What Works Global Summit. My name is Ciara Keenan, and I'll be your host today for this session, and I will ensure that you get as much out of this session as I do. I'm a Senior Research and Development Manager at the National Children's Bureau, and my team work really hard creating and interrogating the evidence of what works so that together we can drive change where it matters most. Today in this session, we have a really incredible lineup of 6 panelists, and they will be making their presentations for 5 minutes each. We will immediately follow up with their presentations with some questions, so please do, I really encourage you to pop some of those questions in the live Q&A. I really hope that you will ask questions. It makes it much more interactive and much more fun for all of us. So without further ado, I'm delighted to first introduce you to Karen McConnell.
Thank you, Ciara. I'm delighted to be here to present this evidence and gap map on video-based interventions promoting social behaviours for autistic children. Next slide, please. Autism spectrum disorder is a lifelong neurodevelopmental condition affecting more than 1 in 100 people in the UK. And video-based interventions may be a promising approach to teach positive social behaviours to autistic children as they allow for consistent delivery across different places and people. So the aim of this research was to identify, map and synthesise existing primary studies on video-based interventions for autistic children. Next slide, please. Campbell collaboration guidelines for evidence and gap maps were followed, and studies were eligible for inclusion if they included autistic children, used a video-based intervention, and evaluated social outcomes. EpiReviewer was used to manage the studies, and EpiMapper was then used to create the interactive evidence and gap map. Next slide, please. Studies that may So there were 438 primary research studies included in the map, and 90% of these are single subject research designs and 10% are group designs, with 6% of those being randomised controlled trials. I'm now going to play a video showing the map in action. Next slide, please. So that's the video. And we'll look at filters in more detail. The evidence and gap map can be accessed at the link on the slide, and when you go to the map, it will look like this. Let's start with the toolbar along the top. Filters allows you to see a subset of studies that meet certain criteria, and we'll look at filters in more detail shortly. Hide headers does what you would expect and hides the map title and logos. Full screen allows you to view the map on the full screen. The About tab tells you more information, including the title, and has a link to the protocol. And then view records, so you can see the number in brackets here, 438. This is the number of records currently being shown in the map. And if you click on this, it brings you to an area where you can view the different studies, their abstracts, and also where you can download an RIS file. And we'll look at this in more detail shortly. Upon looking at the map itself, you can see that there are row and column titles. These are the map's framework, and the framework guides the eligibility criteria. So in this map, the columns are the social outcomes and the rows are the types of video-based interventions. In the map, you can hover over a cell to see more information on the studies it contains. For example, if we look at studies using video modelling to promote social engagement, we can see 63 of the studies took place in school, 20 in a clinical environment, etc., etc. As mentioned earlier, you can use filters to display the evidence and gaps most interesting to you. So let's look at an example. So you start by clicking on filters to bring the filter tab up. You might be specifically interested in evidence and gaps in females only. In this case, you would select female and click update, and the map now shows the evidence and gaps for females only. So the same as before, you can hover over the cells that you're interested in. And at the top, you can see beside view records, there are 17 studies being displayed in the map with the female filter on. And if you want to clear the filters, you just click on filter again and clear filter and then update. So once you've applied the filters that are of interest to you, you can view the records. So we've taken the filters off, so we have all of the studies that are included in the map here, so 438 of them. So if we click on this, in here, you can select the individual references to read the abstract. So you can see you can click on the different references and it brings you to the abstract. And the bottom of each abstract, there is a link to the study itself that you can click on to read. Within this section, you can also filter the map here by outcome and by type of video-based intervention. For example, you might be interested in the evidence relating to imaginative play only. In that case, you'll make sure that imaginative play is selected, and you can see that there are 64 studies that have imaginative play as an outcome. You can also click on download listed references to download an RIS file that works in reference management software like EndNote and RefWorks. Okay, so thanks for watching the short video. So as you can see from this video, the evidence and gap map is useful for highlighting gaps in the evidence as well as areas of sufficient research that can be used to then inform practice. So in terms of ongoing work, this map is going to be made publicly available. And we're also currently completing a meta-analysis on the group designs to allow us to quantitatively answer our research questions. Next slide, please. Okay, so I'd like to just finish by acknowledging the rest of the research team, COHeRe Keenan, Catherine Story and Alan Thurston, and I was part funded by the Health Research Board and Public Health Agency through Evidence Synthesis Ireland. Thank you for your time and attention.
Thank you so much, Karen, for that wonderful presentation of the work mapping out social outcomes using video-based interventions for autistic children. I wanted to ask a question, Karen, if that's okay. So I know you personally, and I know you're a lecturer, and I wondered, now that you've been through your own process of building an evidence and gap map, do you have any particular reflections or thoughts on whether evidence and gap maps are useful for students to engage with, and if so, why?
Yeah, that's great. Thanks, COHeRe. So I had never actually heard of evidence and gap maps until I started my ASI fellowship, but I really see the benefit in them, and I think that they're really useful for students because essentially they're providing a really user-friendly summary of the evidence in one place. Searching for evidence can be quite overwhelming for students, and the fact that the systematic searches and the screen have all been done on a particular area saves students a lot of time and also can save some anxiety for them as well. I think they're particularly useful for students who are doing a research dissertation because students can very quickly see where there's a lot of evidence already. So it helps them to avoid that duplication of primary research and also highlights the areas where there's maybe a need for evidence synthesis via systematic review. And students can then also see where there are gaps in the evidence that could then help them to or guide them to develop a research proposal or research protocol. So I suppose thinking in terms of the master's students that I have, a lot of them are very busy, as you would expect, or doing a master's part-time, trying to juggle work and family life too. So I think that these benefits of the map are particularly useful for those students because the searches and the screening has already been done.
Thanks, Karen. And yeah, I totally agree, you know, and they're so useful for many key stakeholders, but I often think of, you know, how funders can engage with maps as well and see, you know, visually where there's saturation of evidence and where there's gaps, and that makes a strong case for directing much needed resources towards those areas as well. We have one comment from the chat where they would like a link to the evidence and gap map Would you be able to say something more about that?
Yeah, so we're currently working to host the Evidence and Gap Map live, and it'll be publicly available and it'll be free. We just haven't quite got it hosted yet, but once that has been done, we can certainly send that information on to the attendees of this session.
Thanks very much, Karen, and I'm sure you're open to people reaching out to you directly on Twitter or by email. So thanks again. So next, I'd like to introduce our second speaker today, Gloria Odei Obeng-Amoako. So yeah, take it away, Gloria. Thank you.
Thank you very much. I'm privileged to present to you an evidence and gap map of the impact of infrastructure on low-income consumers, nutritious diet, women economic empowerment, and gender equality in low and middle-income countries. Next. Next, please. Hello. Hello. Next. Okay. Physical infrastructure such as markets and roads foster gender inclusive economic development and mitigates adverse effects of seasonality on, okay. This is the map we have done so far with 50 out of 98 eligible papers we have identified through, okay, you brought back the previous slide, thank you.
Sorry, my fault.
Okay. So, okay, no problem. Okay, all right. So this flow chart shows the data sources or the databases we searched systematically to identify eligible papers for this, our EGM on impacts of infrastructure on nutritious diet, women economic empowerment, and gender equality. We searched relevant academic databases and also searched about 35 organizational websites and contacted key authors. And we also used OpenAlex in Epi Reviewer through machine learning to identify additional papers. Currently, we are screening more papers from these searches, and we have identified about 98 papers which will be eligible for our map. Next slide. Next slide, please. Yes, thank you. So we use 50 out of the 98 papers eligible to do this preliminary map. And we realized that about 28 papers reported the impact of infrastructure, irrigation infrastructure on nutritious diet, women economic empowerment, and gender equality. And most of the papers reported on the or productivity or yield as a result of. So in this map, you realize that the bigger the bubble, this blue bubble, it shows the amount of evidence that exists on the topic we are interested in. So we use filters, we use the study designs as filters. So this map will be available as a public good for potential users. Thank you. Next slide. In conclusion, upon completion of this evidence and gap map, this will be made available. It will be a platform with a body of evidence on the relationship between infrastructure, nutritious diet, women economic empowerment and gender equality for potential users. The findings would inform decision-making on future evidence synthesis and primary research useful for the ongoing discourse on sustainable food system. The findings would also have academic and evidence-based policy implications for decision makers in allocating scarce resources to under-researched thematic and geographical areas. The findings will highlight types of infrastructure that positively impact nutritious diet, women economic empowerment, and gender equality, and would also inform advocacy for scaling up of infrastructure interventions for equitable livelihoods and gender equality and women economic empowerment. Next slide. Next slide, please. You may reach us for more information on this evidence and gap map. We would like to acknowledge Campbell Collaboration for their support and also Bill and Melinda Gates Foundation for funding this EGM. Thank you very much.
Thank you so much for that excellent presentation, Gloria, on such an important topic area. I can see that you're presenting evidence on physical infrastructure across two distinct geographical locations, so Sub-Saharan Africa and South Asia. And I wondered if you could talk a little bit more about how those two settings are similar in terms of physical infrastructure.
All right, thank you very much. Yes, we chose these two regions because current evidence show that most of the countries in these two regions, Sub-Saharan Africa and South Asia, are classified as low-income countries or middle-income countries. And most of these countries also have large populations who are classified as poor or low-income consumers. And we also realize that most of the reports show that infrastructure development in these two regions are quite low, especially Sub-Saharan Africa, even when you compare with South Asia. For instance, a report by World Bank published in 2018 shows that road density in Africa, when you compare 1990 to 2011, even reduced compared with the other regions. And we have seen from evidence that by investing in infrastructure such as road, we would be able to improve development or reduce inequalities in most of our countries. And we'll get closer to achieving the SDGs, yes, through investing in more infrastructure. Thank you very much.
Thank you, Gloria, and personally, I really appreciate understanding that context a little bit more, and I would love it if you could share a link maybe in the discussion after this, just so we can access and investigate the map, because it sounds really important. Thanks, Gloria.
Thank you very
I'm going
much.
to pass over now to our third presenter, Rachel Leonard. Thank you.
Thank you.
Hi, Rachel, are you here? Hi, everyone. It seems like Rachel has dropped off the call. So while she's reconnecting, I'm going to go to the next presenter on my list, who is Philip or Orishaba. Okay, Philip. Hi, Philip. Philip, I don't have sound for you. Philip, while we're sorting that out in the control room, I'm going to pass on to the next presenter, Anil, Thota. But don't worry, Philip and Rachel, we'll come back to you. Anil, can I check that your microphone's working?
Yep, can you hear me?
Excellent, brilliant. We'll get your slides up. Anil, thank you.
Thank you. Hi, everybody. Good morning from Toronto, Canada. My name is Anil Thota. I'm an evidence synthesis specialist with the UNICEF Office of Research in Innocenti. The office is located in Florence, in Italy, and we work with a group of collaborators on an evidence and gap map for inclusive interventions for children with disabilities living in low and middle income countries, as classified by the World Bank. And for inclusive interventions, we define that as activities and services where children with disabilities can take part in equal way to everybody else. So that's how we conceptualize inclusive interventions. Next slide, please. So to sort of create an evidence and gap map on this sort of broad area, we looked at 7 domains for intervention. So that included inclusion in health services, how children with disabilities were included both in specialist as well as general health services and health promotion activities, inclusion in education, interventions that promoted awareness and non-discrimination against children with disabilities, protection of children with disabilities, adequate standard of living, family and community life, and empowerment. And we had multiple interventions within each of these domains that we conceptualized as being an inclusive intervention. And for the relevant outcomes, we also had 7 domains. So health and well-being outcomes, access to health outcomes, education attainment and educational related outcomes, adequate standard of living, violence prevention, empowerment, and cost outcomes for economic evaluations. Please click. And to look across the interventions and outcomes, we had these filters that were set up in the evidence and gap map. We looked at the various settings, like the home setting or the community setting or schools or even online sort of settings. We looked at the individual countries where this was happening and the UNICEF sort of regions where the studies were taking place. The study design, of course, we included both systematic reviews and individual study designs. And then population characteristics such as the age, the gender, and other characteristics. And we also had the various characteristics of the interventions that we included. Next slide, please. So from our search, this is the flow that we had. Click, please. So we had a very, very massive, wide-ranging, sprawling search because we had so many domains and so many databases and great literature sources. So we ended up with more than 100,000 hits when we first did the search. So we did an initial quick title screening and eliminated about 75,000 of them. And then that left us with about 25,000. So for which we used EpiReviewers priority screening, which is its machine learning tool that sort of learns from our answers and then pulls up the studies that we are most likely to include, that the team is most likely to include to the top of the pile so that those show up first. And that way we do not have to screen all of the 25,000. So we use that system, we learned a lot from it, and we ended up having to only screen 9,000. That's quite a large number, but small compared to the 100,000 that we started off with for the titles and abstracts using this machine learning tool, which is called priority screening from EpiReviewer. Moving on. So from that, we excluded another almost 7,000. We had about 2,000 for full text records to screen, still a large number. And after screening the full text records, we finally ended up with about, click please. You can click again, please. And so we ended up with 155 records, which went to the EG. Next slide, please. So if you look at the study designs and the intervention domains, please click. Yeah, 75% of the studies in the EGM were from the inclusion health services that included mostly access to habilitation and rehabilitation services related to the disability for children, and also access to specialist services, and also access in terms of community health workers or lay health workers or trained health workers visiting households of children with disabilities. We did not have too much in terms of access to general health services and other things. And then if you look at the other domains, please click. We saw major gaps here when we thought about interventions to prevent discrimination or interventions to improve the standard of living or empowerment, family and community lives. They were relatively much smaller than the inclusion health services. Next slide, please. So in summary, as I said before, 75% came from the health domain, inclusion health services, specifically on specialist services. We also had a fair amount of studies on inclusive education. However, sort of these studies were lacking in detail on how inclusive education was approached and how they were defined and how they were characterized. But we did have a number of studies. But then, like we said, the other domains such as stigma and discrimination and protection were sort of sparsely represented. Further, middle-income countries were represented about 90% of the evidence. So only 10% came from those countries classified as low income by the World Bank. Studies which focused on girls were only 2% of the entire EGM, so that was a big gap that we identified. And then humanitarian settings, we practically had nothing on interventions in those settings for children with disabilities. Next slide, please. So please contact us if you want to know more. We also, UNICEF-Innocenti also has a microsite for children with disabilities, which has so many other resources as well. A report is coming soon on the EGM, and also the EGM, the map itself, you can see a screenshot there, is also going to be released with the report. And I believe it will be in the month of December to go with the International Day of Persons with Disabilities, which is in the first week of December, on December 3rd, I believe. So stay tuned around that time when you will get both the report and the interactive map that you can look at. Thank you.
Thank you so much, Anil, and a bit of a cliffhanger there with the coming soon. So I'm really looking forward to seeing the map, and also a big shout out to the EPI Centre in London, because we're seeing lots of EPI Mapper software being used. I use the tool a lot and really love it. It's really user friendly, and the maps look fantastic. All the maps so far that we've seen look great. Anil, if you don't mind, I've got a question. So your searches threw up 1 million hits. That's enough to put fear into anyone, I think, any systematic reviewer. And we know that in the past, I mean, those kind of searches, we would just know that screening would be much too resource intensive. And I think that's probably led to methodologists creating narrower and more targeted reviews in the past. So I guess my question is around, like, the machine learning element seems to have ensured feasibility of this kind of research and started to solve some issues around scope of these questions. So can I just ask, how did the machine learning component help you frame the scope of your research specifically?
Yeah, that's a great question. I don't know if I have a straight answer to it, because machine learning and especially priority screening was new to us, and also dealing with 100,000 hits, we were not very sure if that would be too much for the priority screening as well. So we did an initial round, a very quick round, where we just eliminated the title on the title basis, just irrelevant ones. So that was manually done. So that definitely added a bit of work. It's just that our EGM was broad. But for the priority screening, I think we tried to do the seeding, so-called seeding, which you do in the beginning to sort of teach the machine. We tried to include studies, like selectively include studies from all of the domains to help it learn all of the domains that we were interested in, because it's so broad. It goes from health to education to sort of stigma reduction, empowerment. So empowerment can be quite it's very different than sort of inclusion in health. It's just the types of the research that you get. And then, fingers crossed, it worked beautifully. I mean, I think it reduced our work by, you saw the flow chart. We saw 30% as a reasonable cutoff to stop screening. I mean, of course, they do recommend that you do screen all the way, but I think the way forward, I think we will see more people that can stop at 10%, maybe 30% at least now, maybe even lower in the future. It can really add to the efficiency of our evidence synthesis products.
Thanks so much. And sorry for the million hits. I'm not good with the numbers, obviously. And I see Sergio is attending today, so thanks to you as well, Sergio, for all the support at Epicenter.
Yeah.
So we're going to try again with Philip. I know there was some connection issues. So Philip, if you don't mind, this is Philip Orishaba. Thanks, Philip. Sorry, Philip, we can't hear you while we're trying to solve that issue, and also we're trying to get Rachel back in the call as well. We're going to go to Yanfei Li.
Yeah, I'm here.
Yes, we can hear you loud and clear, Yanfei. Thank you.
Okay, can you hear me, COHeRe?
Perfect, thank you.
Yeah. Okay. Many thanks, COHeRe. It's my great honor to attend this conference. The topic I would like to share today is the reporting quality of the evidence mapping needs to be improved. And next slide. Next, please. Okay. Yeah. And we know evidence mapping emerged in the 2001. It focused on the wider range of research fields and aims to comprehensively display the current research status and the evidence gaps, provide the best evidence for the scientific decision making and the priority setting for develop a new research. From the evidence mapping published so far, there are various terminology, including evidence mapping, evidence map, gap map, mega map, and map of maps. These different terms seems to be indistinguishable in practice, especially for terms such as evidence mapping, evidence map, and gap map. However, in a strict sense, these terms are similarly different. And our team tried to clarify the relationship between these terms. And just showing a picture, we hold the opinion that evidence mapping is a methodology, and based the methodology, a number of evidence products, including evidence map, evidence gap and map, map of map, and the mega map have been developed. Okay, next slide. Okay. In our previous research, we conducted a literature survey on the Web of Science database in February 2022, and found that the number of published evidence mapping is increasing year by year. According to preliminary findings, a total of 320 studies were included, especially since around 2015, the number of relative studies has increased rapidly, which may be caused by the large number of studies on evidence mapping methodology published around 2015. And in China, our team first introduced the concept and method of evidence mapping in 2011, and at present, maybe they have 26 Chinese-related studies have been published, more than 50% of which are from Lanzhou University. Okay, and the next. Okay. Further, we conduct a preliminary analysis of reporting from 320 initially included evidence mapping studies. In terms of reporting, about 60% studies clearly specified the study design in the title, but used different terminology, and about 50% use image to present the current evidence, but only 20% studies report the process of defining evidence presentation frameworks. And with the extensive development of evidence mapping in various research fields, how to standardize the research reporting and further improve the reporting quality of evidence mapping was becoming a key topic of research in the future. And the next. On the whole, the reporting quality of evidence mapping is relatively low and present, maybe, and the increasing attention of researchers to evidence mapping and the related quality may be further improved in the future. In addition, lack of reporting quality and methodological quality tools may also be an important reason. We are conducting research on evidence mapping reporting standards. You are welcome to join us. That's all. Thank you.
Thank you so much, Yanfei, for that excellent presentation. I have a question, if that's okay, Yanfei, because I noted that on your final slide you have invited our audience to help with continuing your research on evidence mapping reporting standards, and this kind of citizen science is really exciting to me personally, and I wonder, how would you like us to assist the work, and how do we get in touch with you as well?
Okay. Good question, and thanks, COHeRe. At present, we are carrying out research on evidence mapping methodology, mainly the research and development of evidence mapping reporting standards. This project is still in the stage of writing the proposal, and we will mainly include 3 parts. And one part is literature review, and another is expert consultation and expert consensus meeting. Currently, we are recruiting researchers with experience in evidence mapping to participate in our expert consultation step. If anyone is interested in the reporting standards for evidence mapping, we also welcome them to participate throughout our study. Thank you.
Brilliant. Well, you have a captive audience here, and audience members who are obviously interested in evidence mapping. So I hope people do reach out. I'll definitely reach out to you around that, Yanfei. We're going to try again with Philip. There were some issues with microphone connectivity, so let's see if Philip's microphone is working.
Thank you.
Hi, Clara.
Brilliant. We can hear you. Thank you, Philip. Take it away.
Okay, great. Sorry about the back and forth. Hi, everyone. Good afternoon, and good evening, good morning from wherever you're watching from wherever you're attending the conference from. My name is Orishaba, and I'm presenting this work from the Makerere College of Health Sciences from the Center of Rapid Evidence Synthesis. So this is work we are doing with the Ministry of Health Uganda, as well as the Uganda National Health Research Organization, and this is just part of the situation analysis. So we are using evidence and gap maps in showing priorities for health research for Uganda or for the Uganda's health sector for the next about 10 years. So this is part of the situation analysis, like I've mentioned. We are doing the situation analysis in 3 steps. We have a document analysis, and then we have mapping the evidence and gap maps, and then we are also having conducting consultative meetings with so a variety of stakeholders who are involved in health research. Next slide, please. So our rationale is really based on the Health Services Sector Development Program, which emphasizes the use of evidence or relying on evidence in generating these priorities for the health sector. And like I earlier mentioned, we want to set priorities for the next 10 years for the health sector. So we are basing on the current state of health research in order to develop these priorities. And something that we are bringing to this kind of process is mapping gaps for the whole health sector. So previously, research or researchers or the health sector has really set priorities that are basically disease-based. So what we are adding to this kind of process is looking at the whole health sector. So we are looking at all the 7 pillars of health. We are looking at human resources for health. We are looking at health financing. We are looking at provision of essential medicines and all those. Next slide, please. Yes, so our specific objectives for this entire exercise, the research agenda exercise, is really to bring to the attention of the health sector the priorities that should be researched on for the next about 10 years. And the objective that we are focusing on for this presentation is really mapping all Uganda's health research outputs, including the published research and grey literature since 2010 up to now, so that we can be able to identify the gaps, to identify the areas that haven't been studied, and then we can, based on this, to actually form priorities for health research. And this is really going to be used by both people who are involved in research, and then the donors, the health sector, the ministry, and everyone else that is involved in health research and decision-making for the health sector. Next slide, please. So for this evidence gap map, really what we want to do is to understand the size and the scope of health research. And like I said, this is going to be from 2010. We shall be looking at all the work that has been published. And this is both work that has been published in peer-reviewed journals, work that we can call grey literature, work that is not really published, and it's just available on organizational websites. So we want to visualize these gaps and then in form of an interactive map, and then we can be able to show the priorities that need to be researched on for the next maybe about 10 years or more. So we also want to enable policymakers and practitioners to identify or to explore the existing evidence, so that in case they want to make decisions, they can really rely on this evidence to make the decisions. Next slide, please. So our eligibility is from 2010 and onwards, and then we are only looking at the studies that have been conducted in Uganda. And like I mentioned, these are the ones that are covered by the 7 pillars of health. And like I earlier mentioned, we have things like human resources for health, we have healthcare financing, and then we have essential medicines, we have leadership and governance in health, and then we shall also be looking at some cross-cutting themes, things that are related to climate change, and really things like road traffic accidents and several other that we can look at as being cross-cutting with health. Next slide, please. So we performed a document analysis and came up with a couple of themes that we shall be looking at for this exercise. And for the raw matrix, we have about 4 themes, and these 4 themes can be broken down into supporting evidence generation and use for informed and inclusive policy making. And then we have a theme 2 being research on control of infectious and non-infectious diseases or conditions or disorders. And this is on the next slide. Sorry, I this because I'm running out of time. And then we also have the health systems being our third theme. And then we also have environmental health, road safety, and public health emergencies. So these are the ones that will form our rows. And then for the columns, we want to present this as really as a form of study characteristics, where we get to say that this is the number of maybe observational studies that have been conducted under each particular theme. And like you saw in the previous slides, we have quite a number of subcategories that we are looking at. So for instance, we would be saying that this is the number of observational studies that have been conducted on neglected tropical diseases, or this is the number of systematic reviews or evidence and gap maps that have been performed on this particular subcategory of a theme, where we have things related to maybe basic nutrition. So then we could be saying this is the number of impact evaluations or maybe observational studies that have been conducted about child health or adolescent health or reproductive and maternal health, and several other filters that we shall be able to create on the interactive map. So for each one of the column the subcategories that we'll be having, we also want to subcategorize this into ongoing studies, and then we can also say that this is either a thesis or dissertation, and then published reports, working papers, and then monitoring and evaluation reports, because we do understand that most of the decisions that are made are actually based on each of these type of research outputs. So this EGM will be used in such a way that we have all the health research that has been conducted since 2010 in one place, and it can be easily accessible by all the policymakers or the decision makers. It could be the donors, it could be our decision makers in the Ministry of Health, or it could be researchers and then the students as well. So we've defined all these fields of health as defined in our framework. They have, like I've shown, all these subcategories actually have definitions. We made use of the World Bank definitions in refining our definitions, and then we also sought expert opinion from people that have really been involved in health research. So the researchers can then identify the areas where more research is needed, and then policymakers as well can, based on this available evidence, to commission studies if the gaps are really visible on the interactive map that we shall come up with. Yeah, like I also earlier said, this is work that is ongoing. Right now, what is ongoing is title and abstract screening. And from this, we shall generate the interactive map, and then it will inform our initial list of priorities. And then we shall go ahead and perform consultative meetings, and then so that it can help us to come up with a comprehensive health research agenda for the Ministry of Health and for the Uganda National Health Research Organization. Thank you so much.
Thank you so much, Philip, and thank you very much for sticking with us through those technical difficulties as well. And Philip, I had a bit of a question around your presentation, which was excellent, and thank you so much. And I can see that you're really committed to ensuring an effective knowledge translation and transfer plan to really enable access to the health research agenda for all interested stakeholders. And I'm just wondering, in your own context, how much of a barrier has accessibility been in the past? And how does your project seek to solve that issue?
Yeah, okay. Thank you, Clara. So for most of the research agendas that have actually been performed in the health sector, most of these have only been focusing on diseases. So we only have research agendas that are based on diseases or health conditions, and anything else that is really affecting the health of the people. And then these other sectors, and then these other subcategories or pillars of the health system have been left out. And really what we are trying to do here is to put all this evidence in one place so that when someone has access to this evidence and gap map, they can tell that this is really where a gap is, or this is where more work is supposed to be done. And really, even for the donors, they can be able to tell that this is something that we should do to maybe stop duplication of research. Yes, so this is something that is new to this exercise, to priority setting exercises. And we hope that once we've gotten all this work in one place, then we can use it to inform decision for both the policymakers and the donors as well. Thank you, Clara.
Thank you so much. And I'm absolutely delighted that we have Rachel back, and Rachel Leonard from Queen's is now going to talk about the COHeRe project. Thanks, Rachel. Rachel, we're having some difficulty hearing you.
Hi.
But she says she can't hear us either.
Sorry, can you hear me now?
We can. Phew. I'm very relieved. Thanks, Rachel.
Oh, what an ordeal. Sorry about that. Okay, so my presentation is going to be psychological and psychosocial of COVID health-related behaviours, or COHeRe for short. So the COHeRe project is a UKRI funded study. It was the determinants of COVID-19 health behaviours. There were a number of different phases in conducting the project. However, I'm just going to focus on the evidence and gap. Sorry, COHeRe, next slide. Again, sorry. So we're interested in 9 behaviours. We also looked at 10 different, so these were broad categories. We were interested in both malleable and non-malleable determinants. Each of the different categories were subdivided into, so for example, under cognition, we were interested in how people the behaviour, but also what they thought about and so on. Evidence and gap map had a broad criteria, so we included studies of all designs as long as it on the relationship between a determinant and one of the behaviours of interest. And again, the population of interest was a member of the public of any age. All data extraction was reviewer. So once we had identified eligible studies after screening, we then mapped each study into categories, including things like study design, age, behaviour, determinant, and if they'd use theory of behaviour change. Okay, COHeRe, next slide, please. So our initial search identified 26,724 studies, and from this, we had a total of 1,004 studies included in the final map. These were cross-sectional studies conducted in the general population using self-reported measures of the behaviours and determinants. The large number of evidence came from North America, and this was followed by Asia and Europe. If we've seen fewer studies from Africa, South America, and Oceania, and there was a number of studies that looked at behaviours and determinants across multiple countries. So this is a snap interactive map, which there's a link at the end of the presentation. So it shows the number of studies included in the map by behaviour and determinant. So in relation to the amount of behaviour, social distancing was the most populated area of the map, eye masks and then hand washing. We've seen fewer studies that looked at behaviours such as avoiding the T-zone, cleaning surfaces and respiratory hygiene. There was also a large number of studies that looked at composite measures, so where they combined 2 or more protective behaviours. In relation to, there was malleable determinants in the than malleable determinants, and the largest body of evidence for determinants was demographics, and this was the same pattern we observed with different behaviours. Relatively few studies determinants such as past behaviour, attention, information or intervention as determinants of these behaviours. Overall, the largest volume of studies we observed was between social distancing and demographics, and specifically social distancing, age and sex. Okay, next slide, please, COHeRe. So the Evidence and Gap Map provides an important and valuable resource for researchers, policymakers, and for the public. It summarizes evidence on determining various COVID-19 health protective behaviours. The map can be used to guide future areas of research and public policy during the current COVID-19 pandemic, but importantly, it can also be used to inform future outbreaks of respiratory viruses. The current evidence is largely focused on social distancing and the use of masks, and primarily looks at demographics, these behaviours. Therefore, there is substantial gaps in the evidence base, which should be the focus of research in order to have effective public health message in the area. And last slide. So that's information and a link to Evidence and Gap Map. Thank you.
Thank you so much, Rachel, and double appreciation for you sticking with that and then presenting so wonderfully. I don't think I could have done that, so well done. Rachel, you know, I know the answer to this question, but I guess it will help some members of our audience to know about how you came across to the topics of the systematic reviews that you mentioned that are planned based on the studies in the map. So, you know, was that through looking at the map itself? Was it through engaging with key stakeholders, or was there a bit of both happening?
Yeah. So there was a bit of both. So we took on the advice from our advisor as to, so obviously they looked at the Evidence and Gap Map, and then they decided, you know, which health behaviours were going to be big and which would be, you know, of most interest for policymakers, researchers, and the public. So we kind of determined the reviews based on that, but also, you know, what we found within the map itself. So we have a number of ongoing reviews at the minute, that will hopefully be and of interest.
Definitely, not least to me. So that's brilliant, and that brings us to the end of our session. Can I ask all presenters to just turn on your camera so we can thank and say goodbye to our audience that joined us today for this brilliant session on evidence mapping that wasn't without its technical faults, but we all dealt with it very well, I think. I really want to thank, from the bottom of my heart, the conference sponsors who make things like this possible for all of us to attend, and so much to the Campbell collaboration, Campbell UK and Ireland, Vivian, who's been supporting us behind the scenes today excellently, just for organising such a great event and making it free for us all to join. And it's incredible, really. If people in our audience tweet, please do use the conference hashtag, which is WWGS2022. And make time to network as well in the chat rooms and visit the posters before you leave today. Thank you so much to all the presenters today. Please reach out to them. They're doing amazing work, excellent work, and hopefully there's something there for everyone. So thanks a million, everyone, and hope to see you after this.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you. Bye.
Bye-bye. Bye. Oh.